Do you remember Bill Cassidy? Bill Cassidy, I've made this point before. It's kind of interesting. Like, if he just had been your average, hack Republican backbencher voting to give the country away to the Mercers and the Kochs, he wouldn't have really had much profile. I don't think that he's had any type of weird sex scandal, which I guess is, distinguishing enough for being a Louisiana Republican. But he went out of his way when Jimmy Kimmel did his monologue several months ago, and he said there should be that nobody who cannot afford treatment for a baby should be denied coverage. And he said, I want to pass the Kimmel test. And there was a couple of things that you noticed about Bill Cassidy. One, that he kind of looks like Skeletor. He has a kind of sort of unnerving and disturbing glare. And then over the next couple of months, it was like, this guy just almost in a Trumpian fashion. I mean, rarely does someone lie exactly that blatantly in public and on television in such a kind of high notoriety way. He, of course, had his own assault on healthcare, his own redistribution plan from public healthcare to rich people's pockets, which he was hustling with Lindsey Graham a couple of weeks ago. And now here he is speaking to Axios, to who's this guy again? Mike
Allen.
Mike Allen. And basically, Jimmy Kimmel really hurt this guy's feelings, because the big takeaway of him trying to destroy Medicaid and getting rid of patient protections for pre-existing conditions is that you're just not nice to each other anymore.
But first, Senator, what difference did Jimmy Kimmel make? Jimmy Kimmel, a couple things. And first, for people from Mars, tell us your close encounter with Jimmy Kimmel. Yeah, so Jimmy Kimmel's son, and we all, oh my gosh, how can you not feel for this, was born with a congenital heart disease.
Pause it.
I'm a doctor.
I guess you don't really feel for it, because you literally wrote a bill that would jeopardize kids like Jimmy Kimmel's son unless they're born to multimillionaires. But anyways, go ahead.
Disease. I'm a doc. Although, it's been some time since I've been in a delivery suite.
And your wife's a doc, right?
And my wife's
Dr. Laura.
Dr. Laura, a retired breast cancer surgeon. But I can imagine what happened. The child was born. The nurse and doctor immediately realized the child was blue. They quickly made a diagnosis and knew the child would die. And probably before the mother and the father held, the baby was on his way. They're signing papers. Who cannot relate to the emotional response? And I think that first episode in which I, referring to him, said we should have a test to make sure that his child is addressed, needs are addressed, helped define the terms of the debate. That was so positive. Now, Kimmel later came after me. He had talked to Schumer. The New York Times said he talked to him 3 times, never called me. I wish he had. Not to confront, but to explain. Under Graham
We can
Cassidy,
probably arrange that. So have you talked to Jimmy Kimmel?
No, he never gave me a call.
All right, we'll make that happen.
Please. Under Graham Cassidy, there would be families in Virginia, Texas, Florida, Maine, Indiana, Missouri, I can go down states, who would now have access. The states would have billions of dollars of resources to help purchase insurance for those, or help those families purchase insurance in ways they otherwise would not have.
But did the coverage of Jimmy...
So, yes, there would be new opportunities for fraudulent healthcare plans which did not provide the same protections under Obamacare. That's correct. That's what Trump is trying to do right now through executive order. And then they also would have block granted Medicaid, which meant that Medicaid, as we always explain, instead of being a system where the money is just there based on need, would be fixed amounts and devolved to the states, so that all of a sudden you have very compassionate, very concerned about working class and poor people, very non-racist and xenophobic red state governors who already rejected the Medicaid expansion even under Obamacare to cover people in vital need. They would have the discretion to figure out how to spend a limited amount of money to fulfill the core Republican policy concern of making sure that everybody has health insurance, something that they have dedicated their entire modern project to denying to people. And when their plan from the 90s was actually finally implemented, they have a big problem with it because they've moved even further to the right.
Wait, can't the Jimmy Kimmel test be people have the opportunity to buy healthcare in ways they wouldn't have otherwise now?
Wait, why can't the Jimmy Kimmel test be if you're as rich as Jimmy Kimmel, you're fine?
We're just going to pretend that's what it is.
Why can't the Jimmy Kimmel test be that we can have insurance companies that sell people fake plans door to door, and then they think if their kid is born blue that they'll be fine, and then they go, and then the insurance company denies the coverage, and the kid dies, but we don't get blamed for it because we gave them health insurance.
Two surprises. Your kid's blue, and surprise, your health insurance doesn't work. Cancel each other out.
So I have some bad news and some surprise news. The bad news, your kid's blue. The surprise news is your insurance fake. Fake insurance. Fake news.
That's a branding opportunity.
Yeah, that is a
Fake
branding.
insurance.
Fake insurance. Bill Cassidy. Bill Cassidy out bitching and moaning and pushing fake insurance.
Hi, folks. Sam Seder here. We still need your help on our Patreon page. YouTube ads have come back, but not nearly as much as we had before. So if you can help us out, any little bit helps. Head over to our Patreon page right at this URL, and you'll help us keep helping you by making videos